Chair. Hi, Scott. Hello. Thank you guys for coming. I had some questions for you guys and then some other ones. So, when you guys do the VI-SPDAT and you categorize homeless individuals, do you guys also have a code to categorize certain types of encampments?
Can you elaborate a little bit more on?
Say, for example, there's an encampment where it's majority children and families, they're struggling. Then there's another encampment that's drug-ridden, prostitution is an issue. There's another encampment that's dangerous and violent. Do you have categorizations for encampments?
Not specifically for that. The VI-SPDAT does not track that type of information.
And I understand the VI-SPDAT is for individuals. I'm saying that in a suggestion because throughout our community, what I've noticed from community members is there are certain encampments that they are not okay with. And I'll just share with you that I helped break down my first one like 2 weeks ago, and it was tough. It wasn't tough because it's hard to break down an encampment. It was tough because we have to deal with individuals. A lot of people were crying. We had to help them relocate, which was fine. But that encampment got to the point that runaways knew they could come from town, from anywhere else, and come to this encampment and get whatever they needed. And I'm not going to specify what that was. So I'm suggesting it because now that encampments have grown, we might want to think about categorizing them because people in my community are ready to break down the ones that have gone past the point, that are overriding the community, that parents have to come down to that encampment and find their children in there because they're being housed by other individuals. That's the kind of encampments that people will not stand for in my community. And so I'm suggesting that because we might want to start thinking of it in that way, just like you did with the VI-SPDAT, so that we can talk at a level where we know this one, okay, maybe this is children and we need to handle these families. This one, the one that we helped break down, not one child. All single individuals that were between the ages of 20 and 30, none from my community, all from outside the community, but they found an area that they could just nest in that became overridden with prostitution and drugs, and every single street then was affected by this. So just a thought.
No, and while the VI-SPDAT doesn't collect that specific information, we do work closely with the outreach providers to get that type of feedback from them and inform our approach in addressing different encampments. And it looks different from one area to another.
Understood.
But that exact approach that you're talking about is what we use, for example, in Kaka'ako when the homeless population ballooned to over 300 and it became very unsafe. We coordinated with the city, outreach providers, and other partners, went in and we used an approach focused on the needs of that population to transition over the past year over 290 people into shelter.
No, and I understand what you guys did. I think you guys are doing it fine. And I worked with outreach providers to handle that issue. What I'm trying to say is that we might want to, just like you guys with the VI-SPDAT, have levels of severity. Where this one is at level 10, and we better handle this because the whole entire community is being overrun by it. Okay, that's just number one. Number two, does the city have a stored property ordinance division?
So the city and county of Honolulu has a specific sidewalk nuisance ordinance and stored property ordinance. And they have a team of individuals within the Department of Facilities Maintenance that addresses these issues throughout the city and county of Honolulu.
So the answer is yes. Okay, so you guys are asking to start your own stored property ordinance with the 2 million asked, so you guys are going to do same thing as the city by having the stored property ordinance?
Well, so the laws for impacting the various state departments and agencies is a little bit different than the ordinance that the city has, but we're asking to have a similar function where we can address the stored property needs across multiple state departments, not just on Oahu, but statewide, and that's part of what that 2 million request.
I see, so the city has a stored property ordinance division per the city, and they can do certain things. You're asking for a larger, broadening, same function, but maybe reaches more properties. Perhaps.
Correct, because the laws and rules among different departments and agencies really differ.
Yeah, and so in the event that we have HPD on board, stored property ordinance, the other component is DFM, am I right? Department of Facility Management. So in our area, we have it popping up, and they're telling me that of the three-prong, the two are on board, but DFM is not. What is it that DFM provides that you guys cannot?
So, Department of Facilities Maintenance, where this team is based, the SNO SPO team is based, responds to complaints from the public. So they have a complaint line at the city and county of Honolulu.
And they do it per complaints. I understand
based on
that.
the number of complaints because they only have one team.
I understand that part too.
And they can only operate on city properties or On state properties, if we negotiate a right of entry or an agreement with the city and county to give them permission where they could enforce their ordinances on our state land.
No, I understand what DFM does. My question is the holdup that DFM doesn't have the funding? Is it just a yes or no?
I believe that's part of the issue.
Okay, because everybody else is ready to go, but they're telling me that DFM is not. So what I'm hearing is that they don't have the money to haul and break down.
I believe,
I'm trying to find the gap
I
because we
believe-
can fill the gap if that's the gap.
In discussion with the city and county, I believe that it's a resource, a manpower issue for.
Because they have like
departments.
4 guys in the whole island
Correct.
that do
There's
it.
one team that works around the clock. So they respond at different times of day and night. For some jurisdictions, like a public park, for example, they can only respond after the park closes after 10 p.m.
Right.
And in others, so they work on a pretty heavy schedule. And
That's
it's
good.
just one
Yeah,
team.
I'll reach out to them. I understand where we just needed to get handled. If there's a gap, I can fill that. Okay, so the other question I think I had was the point in time count is next week, and I helped Kalaeloa West organize it for the Waianae side. My question is, after the point in time count, which is a one-time event that helps us to get our federal funding, you are planning to what with that data?
Okay. So the point-in-time count is a requirement by the federal government that we must conduct this survey on a regular basis, and it impacts our community's application for federal dollars. The point-in-time count also gives us information. It collects demographic data, such as the number of people who are chronically homeless, who may be experiencing serious mental illness, substance use, and we use the data from that to inform our decision-making. So when we work with Homeless Programs Office, they can look at that data and figure out how to target and allocate our resources based on the needs reflected in the point in time and other data sets.
I understand that part, and I'm going to go every day and help with the point in time count from Monday through Thursday because I want to go into every encampment. But my question was because many of the volunteers who are participating are wondering, okay, we come out and we help count, and then what? And I'm not saying this is solely on you, because it could be that we need to get together as a community and we need to come up with a plan now that we know what our number is at.
So the point-in-time count is actually coordinated and spearheaded by the Continuum of Care, and there's two. There's one for Oahu called Partners in Care, and one on the neighbor islands called Bridging the Gap. My office has been supporting the COCs, the Continuum of Care, as they implement the point-in-time, and I can share the points that you're bringing up, Representative Tupola, with Partners in Care, so that they're able to better engage the volunteers who have signed up for the point-in-time. One of the things I know that Partners in Care is looking at is how can they leverage that support on an ongoing basis, not just a
Exactly,
one time.
because
So
if
I
they're
will share
coming,
this.
that means they care, right? So we need to continue to engage them by saying, now the point in time count is done. Now we're going to X, Y, Z for our plan or whatever it is. So thank you, Scott. Thank you. You know that I support you, and I know you do a lot for our coast, so thank you. My next question was in regards to the victims of sex trafficking. This was under the, if anybody can answer that. It's just a very brief question. So it says here the funding is for $300,000 to get you in compliance with federal law to train your, service,
It's our.
your
child
professional
welfare- Yes, our
staff.
child welfare service.
So just my real quick question is, who and what program are you using to train them? That's it. I'm just wondering how you came up with the $300,000.
Oh, no. It's only, we're only going to use $37,000 for the training. That's just a small piece of the 300. Majority of it is for the counseling and support services for.
So it's salaries for people?
No. We're contracting services through service providers in the community to help us provide these services.
Okay, that's my question. So what service providers are you guys going through?
Currently, we'd like to use Susanna Wesley because they have a well-developed sex trafficking program. Because sex trafficking, it's a very specified.
I
very,
understand.
you know,
I just was wondering which organization you're reaching out to. The $3,700 that you're using for the training, you're also going through Susanna Wesley?
some of that, and then there's some national trainings that we're looking at
Right.
bringing them down to. best
I'm
practices.
hoping that you guys do that because
Absolutely.
there's federal laws already in place for that, and there's already specific national trainings that we should be
Correct,
participating
correct. And my staff are already attending those,
in.
yes.
Good. Well, we'll be in touch because we're helping the family courts. I'm helping them run a ending sexual exploitation training for all the family court judges.
Yes, we're part of that group too.
Good,
Yes.
good. So we'll talk about
Great,
that.
thank you.
Thank you. My next question was for the in-community youth programs. Hello.
Hello.
My question was in regards to additional funds for juvenile justice and delinquency prevention. So it says here, the first request will support graduated responses to prevent secure detention. What does that mean?
The graduated responses is an array of different services and activities that we can utilize for the youth. As an example, for diversion, when a youth is arrested or about to be arrested, that's one of the decision-making points where a policeman or policewoman can actually issue a citation. We have a demonstration project going on right now in District 5 in Kalaeloa
yeah.
area. And what we're trying to do at that point is to divert a child from entering the juvenile justice system. And so these kinds of sanctions would divert a youth from actually being arrested and provide services for the youth with counseling.
Is this new or is this an ongoing cost?
These kind of programs have been ongoing for the last several years.
So this is just asking for funding to continue
Yes,
this,
definitely.
what you're doing. And that's the same thing for additional funds for juvenile justice reform?
Correct.
So that one's ongoing, but you're asking for additional my question is because the detention center at Kapolei is down to 2 youth in there. Like they've been bringing the numbers down extreme.
Right.
And when I went to the youth correction facility yesterday, I think, the girls division is down to 2 girls left in there. Like they're bringing all the numbers down for juveniles. So I'm wondering like if these services are escalating because now we're just trying to be preventative
Yes,
or?
yes. So part of the Act 201 that was passed in 2014 was the idea that we use savings from the far end incarceration and reinvest them in the front end.
Understood.
Yeah.
To get it before it gets
Correct.
worse.
And yes, and also to really address the root issues underlying many of the offenses that are being committed, whether they're status offenses, runaways,
Right.
beyond parental control, truancy, which is another gateway into the juvenile justice system.
Yeah.
So providing services and programs upfront, working collaboratively with the Department of Education.
So this one that you guys are increasing though, you feel like there's a need to increase the amount of money you put into it even though there's less youth in the
Yes, the trends
system?
nationally and locally have been going downward in terms of juvenile crime. And a correlation with that, I believe, is the investment of services and funding.
Understood.
into
The
community.
investment of services is super
Yes.
important, that we don't cut back on that so that we can be prevent. I'm asking these questions because, you know, the only youth drug treatment center we have is Bobby Benson, right?
Correct.
On the whole island. And so I'm just wondering if we're kind of decreasing these certain numbers, is it your department's, I guess, thought to ever make another drug prevention center so that we can have more than one?
Well, currently on the island of Kauai, they are considering that to their own project with the Kauai
You said
County.
in Kauai.
Yeah, Kauai. We also are exploring that issue within our Hawaii Youth Correctional Facility.
I mean, we kind of need one more on Oahu, just throwing it out there. And I'm not saying that services aren't important, they're important, but having another drug treatment center is important. What kind of monies do you guys expend on truancy?
Truancy, currently we spend about, believe, about 5 to 700,000, I believe.
And what
statewide.
specifically do you do for that?
We fund different programs. Susanna Wesley is actually one of the programs we fund statewide. Basically, they work with the schools and address any of the youth who they're finding are truant and need support services to address, again, what are the root causes.
Do you have something specific to the Waianae Coast?
We have in the past, yes, we do work with In Peace.
They have a truancy component?
Cultural-based or truancy. I believe there is a truancy, and I can look that up.
No, that's good. I can call them. I'm having a meeting
Yeah.
with them tomorrow. No, I'll ask them. Thank
Okay.
you. Because we are the only part of the island that has a truancy court. You know that though, right?
Yes, I do.
So the truancy court can only service Waianae Intermediate, no other schools because of lack of funding. And so we're thinking about starting like a parent truancy council that can be a buffer into the family court system because our truancy is so high out there.
Right.
And obviously when we talk about truancy, we're not just talking about missing school.
Yes.
We're talking about extreme family issues. So my question is if those dollars that you guys expend could be more impactful, you know, by actually, because no offense to Peace, they're a great organization and I'll talk to them about it, but if those monies could go directly towards helping the family court system in their initiatives for truancy, that's what we need.
Right. Collaboration is the key. We also have a service on parent partnerships. We provide support for parents of juveniles who are in the juvenile justice system.
I'm going to have to learn more about
Yeah,
that.
we'll
So
talk about it.
you can send me that. The last question I had was in regards to this funds for cultural healing centers, 400,000. So it says the Office of Youth Services requesting general funds to establish cultural healing centers. So when I read this, it means that they don't exist and your office is thinking of establishing them?
Correct.
Okay, but what if there are cultural healing centers that exist?
Well, we definitely will.
I'm just saying, I don't know if we have to establish them per
Okay.
se, like,
Right,
because
to
we
support.
have cultural healing centers, and I'm just wondering, can the funds go into a cultural healing center that exists?
Possibly, we funded a pilot program actually in Waianae, the Wahi Kana'aho,
Yeah.
with Uncle Wade Lee, and he worked with the youth really in a cultural way, teaching Ho'oponopono.
I don't doubt the goodness of
Right.
what you guys do. What I'm trying to question is the effectivity, because we don't need to be building new ones if we have ones that are out there that need funding or support, is, I guess, what I'm trying to communicate.
Yes. So we're trying to leverage funds, also looking at the different trusts and collaborate.
Right. I mean, Queen
can-
Leokolani Trust is diverting their mission, so I mean, we should possibly leverage that.
Right.
I don't know what you guys are going to do, but I'm going to encourage you not to build something new
Yes, no, definitely not build something.
or establish a new cultural healing center.
Funding, for example, with the Wahi Kana'aho, which has been in operation, but it's currently not being funded.
It's not.
Yeah, but they are in, I think, conversation with the different trusts, and we're looking at how we can collaborate again to provide that kind of services.
Okay, please let me know if you guys need help, because so many of them ask me for funding on a regular basis because they want to exist and do exactly what I'm reading here.
Right.
What you guys wrote, that's what they tell me all the time.
Right.
So thank you, sir. Thank you, Chair.